Hello, my name is Dr. Susan Landers, and I want to talk about how burnout feels. Our healthcare workers, doctors, nurses, respiratory therapists, are becoming overwhelmed with their duties in the hospital and in the clinics. Burnout feels awful. You're physically exhausted, you're emotionally exhausted. This is usually due to excessive call, long work hours, a difficult schedule. Night call is a big culprit. You also feel disengaged from your patients and from your partners or coworkers. And finally, you don't feel like you're making a difference. This is a horrible feeling for healthcare workers who are used to healing and helping and work to make people feel better. When I suffered burnout 6 or 7 years ago, at the end of my 30-year career in neonatology, I thought I was depressed. I dreaded going to work. I did the minimum amount of work necessary. I holed up in my call room, hiding from people. I didn't want to go to emergency deliveries. I didn't want to talk to parents. I didn't want to do any of the things that I used to enjoy doing. I would come home from work and I would drink a glass of wine or two so that I wouldn't feel those feelings, but that didn't solve anything. When I finally figured out it was burnout, I was able to work part-time in a less stressful delivery setting. I started to exercise. I walked a lot outside in nature. I had lunch with friends. I played the piano again. I learned calligraphy, and I talked to a professional. Some healthcare workers are going to feel so bad that they need professional help. And your job as their loved one is to recognize that they're burned out or that they're getting burned out, to help them open up and talk about their feelings, and maybe even to suggest that they get some therapy. This pandemic has really weighed heavily upon doctors and nurses. There's only so much death and dying one caregiver can take. There's only so many emergencies and so many struggles for bed space and so many frustrations with the medical record that you can take. And so burnout is real and they feel it, but it may go on for months before they recognize that they're burned out. So I'm telling you about this so that you can observe in them what might be going on and encourage them to get the help they need. Thank you for your attention. Please send any comments or questions. I so appreciate it.